the 6 fundamental questions that everybody has to consider after successfully cracking NEET PG. You can find the thumbnail of that video on your screen, and I would encourage you to check that video out. I've also answered a couple of questions in 2 different videos, also made quite recently, where I've answered 2 of the 6 questions, whether you should take the seat now or you should wait for another attempt to improve your seat. And the second question was whether you should go for DNB or MD or MS. In the last video where I talked about whether you should choose MDMS or DNB, I came up with a very simple technique. That was first decide which subject you want to specialize in, then find out on the basis of your rank and the basis of the past counseling processes whether your current rank is going to get you that subject either through MDMS or through DNB. Once you have figured that out, choose the option which will help you get the subject you want, because the subject is the most important priority. And at the end of all of this, you find the last piece of the puzzle, that is which college, which state do you want to complete your post-graduation in. Carrying on with this outline, there might be a situation where you have decided to pursue post-graduation in a certain subject, but you are not getting, based on the historical data available to you, you are not getting a postgraduate seat in that subject either through MDMS or through DNB. Is there a third option after NEET PG? And this video is about that third option, which is diploma. Now, if you're not aware of what diploma is basically a 2-year post-graduation course, whereas MDMS, DNB, these are 3-year post-graduation courses. For simplicity's sake, MDMS DNB is called a degree course lasting for 3 years, and the diploma course is 2 years. The other difference between diploma and degree course in the postgraduate system in India is that in diploma you don't really have to do a thesis, whereas in degree courses you have to do thesis. Of course, with the new NMC guidelines, there are various other parameters that you have to fulfill during the postgraduate curriculum, which you should check out from the NMC website. Sounds pretty good, doesn't it? You get to finish your post-graduation in 2 years instead of 3. You don't have to worry about completing research work, that is the thesis. Sounds like an easier method of pursuing post-graduation in a subject of your choice. So what's the downside for diploma? The downside of diploma obviously is that you get to learn the subject in 2 years instead of 3 years. People will not teach you at a faster speed. You have to learn at a faster speed, which is quite challenging. Imagine having to finish a syllabus in 3 months instead of 6 months. You get the picture, right? So that's the difficulty level for diploma, that you have to finish what is admittedly a course that cannot be finished even in 3 years in 2 years. That's the first issue. The second more important issue is that when you look at all the criteria, especially for teaching jobs, they are only offered to people who have a degree qualification or a diploma with a post-diploma degree qualification. If you go to the TEQ, Teaching Eligibility Qualifications Criteria on the National Medical Commission website, you will see that there are 4 kinds of roles that they have talked about, and the eligibility for each role has been mentioned on the NMC website. Senior resident, assistant professor, associate professor, and professor. Starting from senior resident, they have clearly mentioned MD, MS, DNB. They have not mentioned diploma. So that is a very important downside of diploma, that you are, at least on paper, not eligible to be a teacher in a medical college. But if you do not want to be a teacher, if you want to engage in private practice, and if you have figured out the subject in 2 years with further fellowships or further mentorship programs, then who can stop you? If you have the skills and you have the postgraduate qualification, which is a diploma, you can treat patients who require specialist care. If you want to pursue radio diagnosis, your rank is not allowing you to pursue post-graduation in radio diagnosis either through the MD route or through the DNB route, you see that you have the option of diploma in medical radio diagnosis, DMRD. you can choose that. Same thing for diploma in child health. If you're not getting MD pediatrics or DNB pediatrics, you can go for DGO if you're not getting MS in obs gynae or DNB in obstetrics and gynecology. There are many other options. Orthopedics has D ortho, ophthalmology has D ophthal, DO, ENT has DLO. So once you've completed diploma, and if you are happy with your level of skill, then you can continue as a diploma holder. You have the MBBS degree, you have the diploma, you can carry on your life as a specialist in that subject. The only thing you will probably not be able to get is a teaching job in a medical college. Everything else is open to you. In many parts of India, having a DGO or a DCH or a DO or even a DLO is enough for people to lead a fully satisfied and fulfilled life as a private practitioner. So you can consider that. After diploma, if you're not satisfied, then you have the option of going for a post-diploma DNB, which is a 2 year course. And now you have spent 4 years as a postgraduate trainee, and you may have built up more skills than a different guy who may have only 3 years of MS postgraduate training. The interesting thing here is if somebody has done MS or MD or DNB, they can't go back and do diploma in that same subject. The reverse is obviously true. You can do diploma and then go on to do MS, MD, or DNB. So you can go ahead with pursuing diploma in a subject of your choice. That will help you fulfill your dream of becoming a specialist very soon, also in the subject of your choice, hopefully. But while you're pursuing diploma, do keep it in the back of your mind that you might have to appear in a postgraduate entrance exam at the end of your 2 year diploma course, because in all likelihood, you will want to complete your CV by finishing a post diploma DNB or a full fledged MD or MS. So if you're aware of that, then by all means go ahead with diploma. Otherwise, there's also one more point, and I would want you to guard yourself against this. There will be people who will tell you that, but with your rank, you are getting MD in that subject, or MS in that subject, or DNB in that subject. Why are you going for diploma? And if you are convinced that you want to do post graduation in a particular subject, say you want to do it in orthopedics, and you are getting MS in ENT, but you always wanted to do orthopedics, I would urge you to rather go for diploma orthopedics or DNB orthopedics. If you're not getting DNB orthopedics, go for diploma orthopedics if you have always wanted to specialize in orthopedics. Don't compromise with ENT. Don't think the small bones of the ear are going to fulfill your need to work with bones in orthopedics. That's just not going to be the case. So again, there are many people who appear in NEET PG. And I broadly think they are categorized under two headings and not on the basis of caste. The one heading is people who know which subject they want to specialize in, and the other is people who do not know which subject they want to specialize in. If you are one of those people who know exactly which subject they want to specialize in, and if you are getting that option through diploma, not through MD, not through MS, not through DNB, then don't allow anyone else to stop you. The only caveat is diploma may not be the end of your postgraduate journey, but it certainly will begin it without further delay. Keep in mind that you might have to appear in postgraduate entrance exam again to finish off your CV, round it up in a very nice manner. But while you are doing that, you will still have the skills that you would have learned in those 2 years of diploma course, which will keep you sane. I hope you like this video.